So in today's talk, we will be focusing on the normal immune system. How does cancer escape this immune recognition? How does immunotherapy act? What types of cancer is this therapy used for? How is the therapy given? How often to give the therapy? Is the therapy painful? And what are the side effects of immunotherapy? Before we understand what is immunotherapy, it is important for us to note what is the normal immune mechanism of the body. When we say immune system, it is a complex network of structures which is present in all of our bodies, which prevents attacks from bacteria, viruses, fungus, parasites, and even cancer. So how does the B cells and T cells act together to protect us? In short, in summary, suppose say if this is a cancer cell or a bacterial cell or viral cell, an immune cell comes, it recognizes that this particular cell is foreign, and it comes and it essentially engulfs it, it attacks it, and it gets rid of it from the body. So suppose, let us assume now, if this particular cell has developed some abnormality or some spikes on its surface which prevent the interaction between the immune cell and say in this situation the cancer cell, that is when the problem arises. So let us assume this is the tumor cell, this is a spike on its surface. In this situation it is called PD1 and or PDL1 spikes. So an immune cell comes, it tries to eat up this cancer cell, but it is unable to do so because of these spikes. Now these spikes are present all over the cell surface. Now how does essentially immunotherapy act? The most important type of immunotherapy which has been researched so far till date are the checkpoint inhibitors. So these are molecules which goes and it sticks on these spikes and it essentially mitigates the spikes. So now since the spikes are not there, the immune cells are able to come again and eat up the cancer cell, and thereby this cancer cell are inhibited from growing further. So is immunotherapy used since a very long time? It has been developed over the last 10 years. Initially, there was more enthusiasm or more research has been done in skin cancer, that is melanoma. But following this fantastic success in melanoma, its effect has been replicated in other cancers as well, namely lung cancer, kidney cancer, liver cancer, and now it is used in all cancers. Next, we need to understand how often do we need to give immunotherapy. Usually we give it either once in 2 weeks or 3 weeks depending on the schedule. It can be given 4 to 6 weekly as well when the dose is increased. So after giving 3 to 4 cycles of the therapy or 2 to 3 months after therapy, we do a scan again and we check how the tumor is responding. If the patient is responding well for the tumor and if the patient is having a stage 4 tumor, then this therapy has to be continued. Next thing is this therapy painful? Not at all. We are not injecting this particular therapy directly into the tumor, but rather we are giving it in IV fluids, and these fluids are connected to your veins, and this therapy is circulating essentially all over the body. So it not only takes care of the disease at that particular area, it can take care of the disease which is spread everywhere in the body. Does this require hospitalization? You need to be hospitalized for a duration of approximately few hours. Overnight hospitalization is not required for this. What are the side effects of immunotherapy? Fortunately for us, immunotherapy doesn't have the same side effects which normally chemotherapy has, namely hair fall, nausea, vomiting, extreme tiredness. So usually these side effects are minimum with immunotherapy, and few side effects, namely the immune side effects, are most often easily dealt with. So in summary, immunotherapy involves boosting our own body's immune system to fight against cancer. It is given via an IV infusion over a short duration of 1 to 2 hours. There is no need for prolonged hospitalization. The side effects are very different when compared to chemotherapy. They are generally mild and relatively manageable in most cases. Thanks a lot.